Hello and welcome back health and fitness enthusiasts. Today's topic is diabetes type 1 and type 2, explained. Diabetes encompasses a group of medical conditions characterized by elevated blood glucose levels, often referred to as blood sugar. Excess sugar in the bloodstream can give rise to severe and potentially life-threatening health complications. There exist two predominant forms of chronic diabetic conditions, type 1 diabetes and type 2 diabetes. Additionally, pregnant women can experience a temporary condition known as gestational diabetes, which typically resolves following childbirth. Pre-diabetes represents a state where blood sugar levels hover at the borderline, surpassing normal levels but falling below those seen in diagnosed diabetics. Whether pre-diabetes advances to full-fledged diabetes is not always guaranteed. During the process of digesting food, carbohydrates, often referred to as carbs, break down into glucose, which is subsequently transported through the bloodstream to various organs within the body. The hormone insulin, synthesized by beta cells within the pancreas, is vital for facilitating the uptake of glucose by target cells. In individuals with good health, the beta cells in the pancreas produce sufficient insulin, which binds to its corresponding receptor on target cells, thereby facilitating the intake of glucose. In the case of type 1 diabetes, an immune system mishap leads to the inadvertent destruction of the pancreas's beta cells. The precise reasons for this occurrence remain unclear, although genetics are thought to play a significant role. This results in a reduction in insulin production, leading to decreased binding of insulin to target cell receptors. Consequently, less glucose is absorbed into the cells, causing an accumulation of glucose in the bloodstream. Type 1 diabetes typically manifests at a young age, with symptoms often appearing suddenly and before the age of 20. Management of type 1 diabetes usually entails insulin injections, making individuals with this form of diabetes reliant on insulin for proper regulation. In contrast, type 2 diabetes sees the pancreas producing an adequate amount of insulin. However, complications arise either in the binding of insulin to its receptors or in the intracellular signaling of insulin within target cells. Consequently, these cells become unresponsive to insulin, hindering their ability to take in glucose, leading to elevated blood glucose levels. In essence, individuals with type 2 diabetes are characterized as insulin-resistant. Genetic factors predispose individuals to this condition, but lifestyle choices also exert a significant influence. Factors such as obesity, sedentary habits, and unhealthy dietary patterns are associated with a heightened risk of developing type 2 diabetes. Typically, type 2 diabetes presents in adulthood, with symptoms typically emerging gradually and after the age of 30. Type 2 diabetes accounts for a substantial portion, approximately 80 to 90%, of all diabetes cases. Management strategies for type 2 diabetes emphasize weight loss and often involve adopting a low-carbohydrate diet. If you got anything from this video, please like, comment and subscribe, and best of luck on your fitness journey.